You know that moment you suddenly expel air, a cough? We all do it. And if you've got a dog or cat, you've definitely heard their version too.
Hmm.
But have you ever really stopped to think about what's actually going on, especially in our pets?
It's one of those things we just accept, isn't it? A cough is a cough, but uh, this deep dive, we're really going to unpack the mechanics behind it.
Yeah.
We'll look at the medical side,
Hmm.
why it happens, the surprisingly complex process involved, and all the different things that could be causing it in dogs and cats.
Exactly. It's way more than just a noise. It's actually a vital defense system for their airways. And, well, understanding it can give you some really useful insights into their health.
Right, so we've gathered the info, looked at the definition, the physiology, how it all works, the triggers, the conditions related to it
Mm.
in both dogs and cats. The idea is really to give you a solid understanding of this reflex, help you tell it apart from, say, gagging or reverse sneezing, and just appreciate how important it is.
Okay, let's start right there then. What is a cough
Yeah.
at its most basic?
So fundamentally, it's a sudden, often repetitive defensive reflex. Think of it as the body's way of forcefully clearing out the large airways.
Clearing them of what specifically?
Well, it could be excess secretions, mucus and stuff like that, or irritants, maybe foreign particles they've inhaled, even microbes, or sometimes just clearing something stuck farther up.
Gotcha, like hitting the reset button on the airway. And I read there are 3 specific phases to it.
That's right. It's quite structured. It kicks off with breathing in and inhalation. Then phase 2 is forcing air out, but against a closed glottis. The glottis is like the gateway at the top of the windpipe.
So it builds pressure.
Exactly, like holding your breath and pushing. Then in the third phase, the glottis suddenly opens and boom, you get that violent rush of air from the lungs, which makes the sound we hear.
A sudden release.
Yeah.
Interesting. And while we can cough on purpose, for dogs and cats, it's mostly involuntary, right?
Almost entirely, yeah. They probably have very little conscious control over it. So when your pet coughs, it's that automatic reflex kicking in, protecting the lower airways from stuff they shouldn't inhale, or helping to clear mucus. It actually works hand in hand with something called mucociliary clearance.
Which is,
That's like a microscopic escalator system lining their airways, constantly moving mucus and trapped debris upwards, away from the lungs. The cough is like the express elevator for bigger problems.
okay, cool analogy. So this reflex has a pathway.
Mhm.
What the main parts involved? How does the signal travel?
It's a neat little circuit. It starts with specialized nerve endings in the airways, the cough receptors. Think of them as sensors.
Okay.
When they're stimulated, they send a signal up the vagus nerve, that's a major nerve highway, straight to the command center, the central cough center in the brainstem.
And the brainstem, right.
Yep. And from there, the brainstem sends orders out to the effector muscles, the muscles in the chest and abdomen that actually produce the forceful cough.
So sensors, nerve pathway, command center, muscles.
Yeah.
And what flips the switch on those sensors? What triggers them?
It can be mechanical stuff like something physically touching or stretching the airway lining, or it can be chemical irritant gases, inflammatory substances, things like that.
And these triggers, they can come from inside the body or outside.
Both, yeah. Endogenous triggers, the internal ones, might be excess airway secretions or inflammation itself. Exogenous triggers are the outside ones. Think smoke, dust, maybe accidentally inhaling a bit of food or water, a foreign object.
And the research mentioned specific receptor types.
Yeah.
Rapidly adapting ones and C fibers.
The rapidly adapting stretch receptors, or RRs, they're mostly tuned into mechanical things that physical irritation or stretch. You find a lot of them in the lining of the windpipe, the trachea, and the larynx, the voice box area. The C fibers, on the other hand, they respond more to chemical stimuli, think inflammatory chemicals or inhaled irritants. But it's actually quite complex. Even in humans, we're still figuring out exactly how all these receptors and pathways interact to control coughing.
Fascinating. Even something so common holds some mysteries. Now, obviously, coughing is a respiratory thing, but can it impact other body systems? Ripple effects, so to speak.
Oh, definitely.
Yeah.
Within the respiratory system itself, the very act of coughing, especially if it's chronic and forceful,
Yeah.
can actually irritate the airways more, causing more inflammation, which then leads to...
Or coughing, a vicious cycle.
Precisely. And then there's the cardiovascular system. If an animal has a long-term respiratory problem causing chronic coughing, it can put extra strain on the right side of the heart.
How so?
Well, the increased pressure in the chest and lungs can make it harder for the right ventricle to pump blood into the lungs. Over time, this can lead to enlargement or failure of the right heart, a condition called cor pulmonale. And another thing, less common but dramatic, is cough syncope. That's fainting caused by a coughing fit. The intense pressure changes can trigger a reflex that drops blood pressure suddenly.
Goodness. That's serious. So when we talk about pets coughing, is it something seen across the board, or are some animals more prone?
Well, any dog or cat, any age, any breed can cough. But clinically, we definitely see it much, much more often in dogs than in cats.
Really? Why is that?
It's not entirely clear, but cats seem less prone to coughs originating specifically from the trachea, for example. And while any animal can cough, the reasons for coughing often vary with age, breed, sometimes even sex.
That makes sense. A tiny puppy coughing is probably different from a big old dog coughing. What about the sound itself? Can the type of cough give us clues?
Absolutely. Describing the cough sound is really important. And first, you need to be sure it is a cough, not, gagging or retching or even vomiting, which can sometimes sound similar, especially that final heave.
Right. Confusing sounds.
But yes, the sound can hint at the location, like that classic honking cough, almost like a goose. That strongly suggests a problem with the trachea, like tracheal collapse, especially in small dogs.
Okay. Honking equals trachea, maybe? What else?
A really harsh, loud, maybe a sort of musical cough, often followed by a retch at the end, that often points to the trachea or the main bronchi, the big airway branches.
And a wetter sound.
Yeah, a faint, sort of wet or moist cough might suggest fluid lower down, like in moderate or severe pneumonia.
So descriptive terms are key. Dry, moist, productive, meaning they cough something up, honking, harsh, faint. Does it matter when they cough?
Hugely important. The
Yeah.
triggers and timing give big clues.
Yeah.
For example, if pulling on the collar consistently makes them cough, that points right at the larynx or trachea being sensitive.
Okay.
Coughing that gets worse with exercise or excitement, very typical for tracheal collapse.
Yeah.
A cough that's worse after they've been resting or sleeping, that can be a sign of fluid buildup from heart failure. And if you hear other noises along with the cough, like stertor, that's a snoring sound, or stridor, a high-pitched wheeze on breathing in, those usually point to upper airway issues, larynx or trachea again. And obviously, if they're struggling to breathe along with the cough, that signals a more serious underlying problem.
Loads of information just from observing. Okay, let's tackle the big one.
Hmm.
The actual causes. Where do we even start? The list seemed enormous.
It is pretty extensive. We usually try to categorize them by location, upper airways, lower airways, or even problems outside the respiratory system altogether.
All right, let's start at the top. Upper respiratory tract.
Okay, so conditions in the nose and sinuses can cause dripping down the back of the throat, leading to what's now called upper airway cough syndrome, used to be called postnasal drip.
Right.
Then you have direct problems with the larynx, the voice box, inflammation, paralysis where the vocal folds don't open properly, tumors, growths called granulomas, or even laryngeal collapse.
And the trachea. The windpipe.
Lots of possibilities there too. Tracheitis inflammation, maybe from infection, foreign objects inhaled, the tracheal collapse we mentioned, stenosis, which is a narrowing, tumors, all can trigger coughing.
Okay, that covers the upper parts. What about deeper down the lower respiratory tract? Bronchi and lungs.
Down there, we see inflammatory conditions quite often. In cats, there's feline bronchitis syndrome, sometimes called feline asthma. In dogs, common ones are canine chronic bronchitis and eosinophilic bronchopneumopathy. That's an inflammatory condition involving specific white blood cells called eosinophils.
Okay, inflammation. What about infections?
Big category. Bacterial infections, certainly. Viral infections like kennel cough complex in dogs or calicivirus and herpes virus in cats. Parasites are a major one, too.
Parasites? Like what?
Specific lungworms like phylloids in dogs or Alurostrongylis in cats. And of course, heartworm disease is a huge cause of coughing in both dogs and cats, even though the worms live in the heart and pulmonary arteries.
Right, heartworm. Don't forget that one.
Then there are protozoa like toxoplasmosis, mainly in cats, or pneumocystosis in dogs. And fungal infections, blastomycosis, histoplasmosis, coccidioidomycosis, depending on where you live, these can cause severe lung disease and coughing.
Wow. Fungus too.
Yep. And unfortunately, cancer is also on the list. Primary lung tumors or cancer that has spread, metastasized from elsewhere, even enlarged lymph nodes in the chest pressing on airways can cause a cough.
Okay. Now what about non-infectious, non-cancer causes in the lower tract?
Things like chemical injury or trauma, maybe aspirating stomach contents or even water in a near drowning, inhaling smoke or toxic fumes, a foreign object managing to get down that far, chest trauma, even bleeding into the lungs.
That's a staggering list just for the respiratory system.
Yeah.
But you said sometimes the cause isn't even in the lungs or airways.
Exactly. That's really important. Cardiovascular disease is a major non-respiratory cause, specifically heart failure leading to pulmonary edema, fluid backing up into the lungs. That's a very common reason for coughing, especially in older small dogs.
Fluid in the lungs from the heart. Makes sense. Any other non-respiratory culprits?
While other heart issues, like certain tumors near the heart base or a blood clot in the lungs, pulmonary embolism, gastroesophageal reflux, GERD, can sometimes irritate the throat and airways enough to cause chronic cough.
Stomach acid causing a cough.
It can happen. Also, anything that physically compresses the airways from the outside, an enlarged heart or a condition called megaesophagus, where the esophagus gets really big, enlarged lymph nodes, fluid around the lungs, pleural effusion, all can squish the airways and trigger a cough.
Okay.
There are also other causes of fluid in the lungs not related to the heart, called non-cardiogenic pulmonary edema, even things like passive smoke inhalation or, rarely, a reaction to certain drugs. Potassium bromide, used for seizures, can sometimes cause coughing in cats.
It really drives home how a cough can be a sign of so many different things. Are certain pets more likely to get specific types of coughs? You mentioned breeds before.
Yes, breed predispositions are definitely a factor. We already mentioned toy and miniature breeds for tracheal collapse.
Right.
Certain terriers, like Westies, are prone to pulmonary fibrosis, a scarring of the lungs. Eosinophilic bronchopneumonopathy seems more common in Huskies, Rottweilers, Labs, Jack Russells.
Okay.
Giant breeds are more at risk for dilated cardiomyopathy, a heart muscle disease that leads to failure and coughing. Laryngeal paralysis is more common in Labs and other large breeds. And Siamese cats seem predisposed to feline bronchitis.
So the breed can be a big clue. Any other risk factors? Environment, drugs.
Environment can play a role. For example, long-haired cats that maybe aren't groomed often can cough and retch more due to hairballs.
Yeah.
We mentioned potassium bromide in cats. And definitely geographic location or travel history is key for things like heartworm or certain fungal infections or lungworms that are common only in specific areas.
A Jack Russell in Florida versus one in Arizona.
Isn't that
Different risks.
Okay.
Okay, so the vet has taken the history, noted the sound, considered the breed and risks. How do they start sorting through all these possibilities? The differential diagnosis part.
That's the challenge. First, confirming it is a cough, as we said, distinguishing it from sneezing, reverse sneezing, gagging, retching, vomiting. That terminal retch after a cough is the classic confusion point for owners mistaking it for vomiting.
Right. Need to clarify that.
So after the history and physical exam, the next step is often some baseline lab work.
The CBC, biochemistry, urinalysis you mentioned.
Exactly, the minimum database. It might not give a specific diagnosis, but it can point you in a direction, like a high white blood cell count suggesting infection, or high eosinophil suggesting allergy or parasites or that eosinophilic condition. It also checks organ function, which is important if you suspect heart disease or other systemic issues.
So baseline tests. What about more specific lab work?
Depending on suspicions, yes. Heartworm testing is almost always crucial in endemic areas. Blood tests for antibodies to things like toxoplasma or certain lungworms might be useful. If there's any bleeding associated with the cough, checking blood clotting ability is important.
And fecal tests.
Yes, especially looking for parasite larvae, using a special technique called the Behrman test if lungworm is suspected. Increasingly, we use PCR tests to look for the DNA or RNA of specific viruses, bacteria, or fungi. And sometimes tests for other diseases, like Cushing's disease, might be relevant if the whole picture fits.
Okay, so lots of potential lab tests, but often you need to see what's going on inside, right? Imaging.
Imaging is absolutely vital. Chest x-rays, thoracic radiographs are usually the first step. They give a great overview of the lungs, airways, the heart size and shape, the space around the lungs, the lymph nodes. Really essential.
Standard procedure. What if x-rays aren't enough or you suspect something dynamic, like airway collapse?
That's where fluoroscopy comes in. It's like a moving x-ray movie, perfect for watching the airways collapse during breathing. If heart disease is high on the list, an echocardiogram ultrasound of the heart is the gold standard.
Ultrasound for the heart. Can ultrasound look at the lungs too?
Yes, thoracic ultrasound is useful for looking at the surface of the lungs, checking for fluid around the lungs, pleural effusion, or evaluating masses close to the chest wall.
Okay, so x-rays, fluoro, echo, ultrasound. What about actually going inside with a camera or taking samples?
Right, more invasive procedures. Endoscopy, bronchoscopy specifically lets us put a camera down the airways. We can directly see inflammation, collapse, masses, foreign objects. We can also assess laryngeal function.
See it directly. And sampling.
During endoscopy, we can perform washes, a bronchoalveolar lavage, BAL, or tracheal wash. We flush sterile saline into the airways and suck it back out to collect cells and fluid for analysis, cytology, and for cultures to check for infection.
Washing out samples. What if the problem is deeper in the lung tissue itself?
If X-rays show diffuse changes in the lung tissue, we might need a tissue sample. Sometimes a fine needle aspirate can work, guided by ultrasound or CT, or sometimes a biopsy obtained via thoracoscopy, keyhole surgery, or even open chest surgery is needed, but that's less common. If there's fluid in the chest cavity, thoracocentesis, putting a needle in to drain and sample the fluid, is done.
So a whole range of diagnostic tools. And let's say a diagnosis is made. How is the cough treated? Is it always about stopping the cough?
Usually, treatment can happen on an outpatient basis. And no, the main goal isn't just stopping the cough, it's treating the underlying cause. If it's infection, treat the infection. If it's heart failure, treat the heart failure.
Right. Address the root problem.
If the cough is due to inflammation, like in chronic bronchitis, anti-inflammatory drugs are usually preferred over just suppressing the cough. Cough suppressants antitussives are really reserved for cases where the cause isn't fixable and the cough itself is severe, debilitating, disrupting sleep, or actually making the underlying condition worse, like in some cases of tracheal collapse.
So suppressants are used carefully. What are the main types of medications used overall?
It really depends on the diagnosis. Antimicrobials, antibiotics, antifungals, antiparasitics for infections. Anti-inflammatories, typically corticosteroids like prednisolone, often tapered, or inhaled steroids like fluticasone for inflammatory conditions like feline bronchitis or canine chronic bronchitis.
Steroids for inflammation. What else?
Antihistamines might be tried if allergy is suspected, though their effectiveness can be variable. Antitussives, like hydrocodone or butorphanol, are used in dogs. But importantly, there aren't really good, safe, established antitussives routinely used for cats.
No cough medicine for cats, generally.
Not in the same way as for dogs, no. Then there are bronchodilators, drugs that help open the airways. Theophylline is one used in both dogs and cats, relaxes airway muscles. Beta-2 agonists, like albuterol or terbutaline, often given by inhaler, are used more in cats for quick relief of bronchoconstriction, but not usually for long-term control.
And expectorants, things to break up mucus.
Like guaifenesin. Their benefit in pets is actually not well proven, though they are in some products. The best way to help clear secretions is usually good hydration and addressing the underlying inflammation or infection.
Okay. You mentioned situations where suppressing the cough is not a good idea. Can you reiterate that?
Yes, absolutely critical. Antitussives are strongly contraindicated, should not be used when the cough is productive, and needed to clear infection or inflammatory debris out of the lungs, like in bacterial pneumonia or bronchiectasis. Suppressing that clearing mechanism can make things much worse.
Don't shut down the cleanup crew.
Yep.
Got it. Any potential drug interactions to watch out for when treating these conditions?
One key one involves theophylline. Its breakdown can be inhibited by some common antibiotics like fluoroquinolones. This can cause theophylline levels to build up, increasing the risk of side effects like agitation or heart issues. So vets need a full list of all meds the pet is on.
Good point. And once treatment starts, how is the pet monitored?
Follow-up is crucial. For acute coughs, treating thoroughly is important to prevent chronic issues. For chronic coughs, owners need to understand it might be about management and control, not necessarily a complete cure. Regular check-ins, maybe repeat x-rays or lab work, are often needed to adjust treatment. Communication is key.
Managing expectations for chronic conditions. Are there potential long-term complications if coughing isn't managed well, or from the coughing itself?
Yes. As we touched on, chronic coughing can potentially worsen tracheal collapse. If inflammation isn't controlled, it can lead to irreversible airway changes, chronic bronchitis, COPD, emphysema, bronchiectasis, which is permanent dilation and damage to the airways.
Irreversible damage.
Scary. And severe acute coughing fits can occasionally cause those dramatic complications like fainting, rib fractures, a collapsed lung, a pneumothorax, or acute strain on the right heart.
Wow. It really highlights that a cough isn't always just a cough. So, wrapping up this deep dive, what are the main takeaways for our listeners?
I think the biggest thing is that coughing in dogs and cats is a really important reflex, often complex, and it's a primary defense for their airways. Understanding the basics, the triggers, the potential causes, the complications, gives you, the owner, valuable insight into their respiratory health.
Absolutely. Hopefully we've shed some light on something that seems common, but has a lot going on beneath the surface.
And it leads to a final thought, maybe for you to ponder. Given how many things can cause a cough, what subtle clues in your pet's environment, things at home, their routine, or maybe subtle changes in their behavior, might you be overlooking that could actually help your vet pin down the cause of a cough?
That's a great question. Food for thought. If you've ever been puzzled by your pet's cough, we hope this discussion has maybe sparked some new understanding or encouraged you to observe things even more closely next time.